Doctors and NGOs have issued a warning to South Africa over the national health insurance policy. They fear the country could face a mass exodus of doctors if the NHI is implemented in its present form. According to the Health Department's recently released white paper, the NHI is a state-run medical aid fund that will buy all healthcare services. The medical aid scheme cover will be restricted to the treatment of rare diseases and high-cost medicines. Analysts say this would make medical aid cover expensive and dismantle private healthcare. Well, we're joined now by Arvitha Doodnath, a legal researcher at the Helen Suzman Foundation. They have some concerns. Arvitha, good morning and thanks for your time.
Good morning. Thank you for having me on your show.
What about the NHI concerns you, and also others who say that it's going to basically suppress the private sector?
Well, like you said, there's obviously doctors are concerned about where they fit in terms of the NHI. Private practitioners in particular are concerned about where they fit in. There's other concerns about in the white paper proposal that they want to actually increase taxes in terms of trying to get funding from there to fund the NHI, which is definitely not going to work, because as it is, we have an increased tax base. As you can see currently in the news, our economy is not doing as well as it should do, and that's just going to be an increased strain on our economy if we have the NHI in its current form. Okay. So it's not really going to work as it currently is, and there needs to be actually, in terms of the actual white paper, there needs to be a lot of reform done. If we had to talk to a patient or somebody who does go to a private doctor, doesn't sit at a state clinic all day waiting for treatment, how is this going to impact? Let's just bring it home. How is this going to impact on their lives for when they have a cold, when they have a serious concern and need a doctor? In terms of private patients. So how the NHI will work is that the NHI fund will contract to private practitioners, provided they actually pass a guideline or accreditation guideline, as it is. But that is not clear to us as to what the accreditation guidelines or rules are yet. So there might be some practitioners who actually don't fit that accreditation guideline and then are left with sort of no remedy, because they can't either practice here or they won't get work from the fund, and then the workload gets limited. So that will be an issue in terms of the NHI. But I think the private practitioners haven't really been consulted, or the private sector hasn't been consulted before the NHI white paper proposal had come out. So if they had been, the paper wouldn't be so restrictive per se. Tell us more about the concerns of doctors. I mean, obviously you've been talking to a lot of them based on your concerns as well, and the worry that they will leave en masse, and what you just said, that they may not be able to practice as they usually have been, and might have to go into the sort of other sectors. I mean, is that not something that doctors should do anyway, regardless? You should be saving lives no matter where you're asked to do it. Yeah, well, you're absolutely right. So the NHI white paper does say that healthcare practitioners, and it mentions healthcare practitioners, so that I'm assuming includes private practitioners, need to be actually accredited, like I said, have to have accreditation guidelines. So that in itself raises a lot of issues, because like I said before, if you're not accredited, what then happens? And the NHI white paper doesn't exactly tell us what happens if an institution or a private practitioner does not meet that standard. Can they still practice here, or do they have to leave? We're not sure. There's a lot of unknowns in the white paper, and it would be nice if the white paper was more comprehensive. So what's the solution here? What needs to happen? Who needs to get together and talk? Well, I would suggest that the Department of Health actually contact both the public and private sector and actually look at what their issues are and work from there. Obviously, it's in white paper form now, and next it'll be a bill and then soon an act. So it would be nice if comments which are actually taken from the private practitioners and the public sector practitioners and put into that bill. I mean, there's a lot of public-private partnerships which are currently working. Why, instead of having a white paper proposal which is going to change a whole lot of things, not focus on those public-private partnerships and work on those? The focus, I mean, like they say, this is to bridge the gap between the private and public healthcare, and anybody who's tried to get public healthcare will know what a painful process it actually is. I mean, I'm just playing devil's advocate and saying, should the people who can't afford that kind of care, should they not be the priority at the moment? Well, in terms of the white paper, they are the priority. However, we currently have public facilities, and like I said, we have public public-private partnerships, which you still have your referral method, but those people, that segment which are not getting the proper access, can actually access it through that private and public partnership. So instead of, for example, changing the whole system as it is, which is going to cost us billions of rands, we might as well focus on these public-private partnerships and try and actually focus on building more of those, as opposed to bringing in a whole system which might not even benefit those who can't afford it.
Now, the Helen Suzman does take up various causes.
Yes, we do.
What are you going to do about this?
So we've already, obviously the deadline for the NHI white paper submission was the 31st of May. We've already made a submission for the white paper. We've also made a submission on the green paper, and we're currently sending out briefs, which we do on a weekly basis, which is looking at issues of universal health care, what that means for South Africa. My colleague and myself have done a very extensive brief comparing the differences between the green paper and the white paper and how that actually hasn't changed. And yeah, we increase public awareness on a weekly basis.
What about where systems like this have worked or failed elsewhere in the world? Have we looked at that?
Yes. So one of my colleagues has done a 5-series brief dealing with universal healthcare and how it actually has worked in other countries. For example, Canada, Austria. But obviously, those are first world countries. Yeah. But for example, if our government actually did enough research on the healthcare sector, they could have used various models and maybe come up with a model that's unique to South Africa that would work here. Obviously, the NHI white paper in its current proposal doesn't appear to be as though it has been fully researched. Because yes, it might look good on paper, but the practicalities, infrastructure, organizational issues haven't really been dealt with.
Okay, do you know, I mean, it might be a bit early to say, like you say, you've just made had your say on it. Any idea whether you are, the right people are hearing what you have to say and whether you will have any impact with?
Well, we're not sure. I mean, obviously for the green paper the department invited submissions and nothing was taken into account when the white paper came out. So we never know as to whether they would actually, take into account the comments and suggestions made by various stakeholders, or whether it's just going to come out in a bill and then we have issues there.
Okay, so lots of question marks still. Thank you very much.
Yes, thank you very much.
Legal researcher at the Helen Suzman Foundation.